Hi, everybody.
Hi. We're so happy you guys are here with us. We're excited. This is a great topic. We're talking today about essentials in preparing for weight loss surgery. And when I made this topic, I felt like there's some things that would maybe help people that are preparing, kind of help them get ready, help initiate the changes that need to help take a place, and all the things that you can be checking on and that type of thing. And we're talking not just about like an original weight loss surgery, but we're also talking about revisional weight loss surgery. I had somebody reach out to me yesterday and ask me if we're going to be covering revisional surgery. And yes, we are. We're going to be covering both. So whether you're a brand new patient to weight loss surgery, or maybe you're having some kind of revision to a procedure that you've already done, this is for you. Oh, Enid said, love your hair, Brenda. And I want to say, Enid, I'm going to be reaching out to you too, because we got your email. Brittany and I wanted to talk, and we'll be reaching out to you after this event. We wanted to talk to you more. And it looks like we have some other people here with us. So we want to say hi. And Brittany, I know you're on our Facebook. It looks like we have Leticia, Cheryl, Emma, Jackie, Rochelle. If I'm pronouncing that right. Hello, everybody.
We're so happy to have you guys.
Yes. And if we have anybody out there on Facebook, say hi to us as well. Yeah, I'm doing something different today with my hair. I kind of just did the straight look.
I like it.
A little bit. Thank you. Usually have all them curls. Kind of doing just a little, changing it up.
Does it take you longer to do it, though?
Yeah. Actually, both ways take a while, because my hair right now is regrowing. I lost a lot of hair last year, so it's no matter what, whether I curl it or straighten it, I have to do something, or just get it bun. Then it's fast.
Yeah. All right. Should we just jump in, or did you want to do a little intro in case people are new?
Yeah, let's do that. So let's both introduce ourselves for those of you guys who are new to us. How many of you have been on? I know I recognize some of the names of being on our calls before, but let us know if you're new to us or if you've been with us for a while, and where you're at. If you're having weight loss surgery, preparing to have weight loss surgery, how do we need to gear this conversation? Brittany, and I'll let you start with.
Sure. And if you, sorry, that was my dryer going off. We shouldn't have any other interruptions. So I guess first of all, my name is Brittany Patterson. I've been with Procare Health for about a year and a half now. When I first was brought onto the team, I was in the marketing aspect of things. I was creating content, kind of looking at all of our social media pages, and I've always helped Brenda with these lives and our monthly support groups that we do as well. And we're going to talk about those here in a little bit too, I think. So, but yeah, my role has kind of changed and switched over a little bit. Now I am leaning more into the account representative responsibilities, and I'm really excited because it's gotten me, it's enabled me to talk more with patients and dietitians, so that's really exciting. And I'm basically just on the call to kind of answer any questions, give feedback with Brenda, just kind of keep it interesting, and make sure you guys get your questions answered. Sometimes it's easier to have two set of eyes on the chat. But yeah, I'll just pass it over to Brenda. I do get this question, so I want to say this ahead of time. I have myself have personally not had weight loss surgery, but Brenda has, and I'll kind of let her talk about that.
Hello to those of you who are introducing yourselves to
Atlanta. Is it warm there?
Oh goodness. So we have Leticia, and she said she's pre-op. Rochelle says she's the one in Atlanta, and she's having a room in May. And Tara says hello, ladies.
Hi.
So to kind of introduce myself, for those of you who don't know me, I have kind of had a relationship with Procare, our sponsors, since probably about 2012 or 13. I previously, I'm a nurse, and I worked as a bariatric coordinator for a weight loss surgery program south of St. Louis in the Cape Girardeau, Missouri area, and worked for them for about 7.5 years. And then joined forces with Procare probably about, part-time, like working as a consultant, going to them with conferences probably about 3-4 years ago, and then as an employee about a year ago. I don't know. I kind of lose track of time. Originally, how I came to know them is we actually sold their vitamins out of our bariatric surgery clinic, so I got to know their products really well. I also am very interested in personal development and helping kind of people be their very best. I studied my certification in coaching and also in a holistic technique called Healing Touch. So try to integrate like a lot of those pieces. And then I had bariatric surgery, like Brittany mentioned, back in 2013. I had the VSG. So I'm just here to share experiences and kind of what I found has helped. And all of you guys, as you're on this call, I am so excited for you, for if you're getting ready to have surgery or if you've already had it and you're just listening in. You know, these things are life-changing. Like that's why Brittany and I are here, because we've seen it. We know that it's incredible changes that you guys are undergoing and the bravery that it takes to be doing these things. It looks like there's some more comments. Brittany, you want to catch those?
Yeah, I just want to say quickly, we have some people commenting on Facebook, so I wanted to say hello to them. And if you guys see me looking down, I'm looking at Facebook at your comments. So, hi Jackie, she's from Louisville. So excited to have you. We have Bernadine, who is from Berryville, Arkansas. Hello, ladies, welcome. And we have Rochelle from Atlanta. I think we already did a shout out to her. She's getting RNY done in May. Tara, hi. She is set for April. Wow. Just a week after my birthday. She said that she's a little nervous, so maybe we can give her some encouragement throughout the call. And Rochelle said that it's expecting rain today and tomorrow. Yeah, us too. It's pretty gloomy out here today. We might get a little bit of ice tomorrow night too, so. We got Stephanie from Houston, Texas. Hi. She is pre-op as well, scheduled 2/26. That's my brother's birthday. And we have Portia. I hope I'm saying that right, Portia. What a pretty name. Hi, everybody. I'm new. Surgery date hasn't been assigned, but just going through the appointment phase. Yes. Tara, hi. So you know what, guys? It seems like a lot of you guys are pre-op, and I see a lot of new names here. Welcome. But at some point in this call, make sure you stay on, because I'm going to show you our Crowdcast channel and our platform, because we have a ton of topics on there that I think would really be beneficial for you guys that are post-op. You know, and you'll be recovering from surgery, so you can sit down and you don't even have to watch the videos. You can just listen like a podcast. But there's a lot of great topics on there, and we've been doing this for over a year. So I mean, Brenda, how many topics do we have now? Like
I think I looked this morning, I think there's 66 on the live feed, and then we also have probably about 12 to 15 on our support groups. So we have a bunch.
I'll go ahead and post the link for now, and then at the end of this call, if we have any time, I'd love to share my screen and show you guys the Crowdcast platform, because it is great. It's a nice resource. So, all right.
Sponsor, but Procare, because they're bringing us together, and we'll kind of talk a little bit about that too here after we get done with this wonderful topic. I just want to introduce today, saying that what we're going to be basically talking about is we're going to kind of dive into talking about like maybe a little checklist of things of preparing for weight loss surgery, the major things. We're also going to talk about insurance. You know, if you're one of those people who are wanting to have surgery and you want to know what qualifies. We actually did another topic. It was on the financial part of bariatric surgery. That can be found on our channel, and that's some of these things will kind of overcross, but we also will have more. We also are going to talk about private pay, like if you're having to pay out of pocket. We're going to talk about consults and clearances, and the additional appointments that may be required, the lifestyle changes, what kind of things can you look forward to, after surgery. Like those things are real. Like it's important to be able to plan and know that what you're going towards. And then some things maybe like in the period right before surgery, the 1 to 4 weeks before surgery, what kind of planning to do. I actually made like a little worksheet. Brittany helped me with downloading that here. There's a little, yes. And if you are coming back and you that gets lost in the chat box, there's also a little green button at the bottom of your screen that says link to handouts. It's a call to action button, and you're welcome to find it on there. It's at the very bottom of that page of that of our support group handout page. So I'm gonna actually pull it up, Brittany. I'm hoping if I freeze, I will come back onto screen. If I and I may have you pull it up if that's the case. Sometimes we've been having technical things going on, so I'm gonna try it here.
I'm gonna go ahead and pull it up just in case too. It was only just the one handout, right? The 4 pages?
Yes.
Okay.
Okay, I'm gonna share my screen here. And I'm going to pop right onto it right away. Let me know if you can see it.
Mm-hmm. Yeah.
Okay. Here is our, actually, when you go to our Procare page, just in case you guys are new to the Procare website, all across the top here are tabs. And Brittany can kind of navigate you through this here in a little bit. But right now, we're going to go to right here, About Us, Support Group Handouts. And we're going to go to the very bottom of this page. I want to mention too, guys, we have a very, very big day tomorrow planned. We're giving away all kinds of free stuff at our support group giveaway. If you haven't registered for that, please log on and do so. We're really excited. We have 15 different vendors. So there's two different buttons that's on this page as well. Be a part of that. Everybody gets an attendance prize as well. So at the very bottom, Essentials in Planning for Surgery. I'm going to open it up. And we're going to pop onto that. Can you guys see my screen now?
Yes. Okay. Sorry, I had to mute myself. I think I'm going to have another sneezing attack, so I might be muted for a second.
So, as I'm showing this, I just want to mention...
Oh, hold on real quick. We do have a question. I'm sorry to interrupt. No. Jackie... Well, we have quite a few comments, so I'm going to read them real quick. Bernadine on Facebook said she's from Arkansas, and she had gastric bypass in 2019. So we do have some people that are post-op. I have already had the surgery, but now I'm scheduled for FDL surgery in May. And Jackie asked, what's the name of the support group? So, Jackie, I'll go ahead and post the link to the registration for the support group for you.
Okay. Thanks, Brittany, for doing that. I appreciate it.
Yeah, no problem.
And you guys, as you can see over on the left-hand side, there's 4 pages to this handout, and I'm not going to keep it open during the whole thing because I think it's distracting. It's going to be, and it doesn't really fit the screen real well for you to be able to see it if you're on a smartphone. By the way, this Crowdcast app is on smartphone, so if you decide to go back and watch an episode later, as long as you're registered for it, you can pull it up on there and you can listen in. But there's 4 pages to this document. The first one is kind of a checklist. The second one is timeline of preparation. The third one here is timeline. And the fourth one is timeline. So we're going to be kind of navigating through that. I'm going to log off and stop sharing my screen on that. I just wanted to let you know that that handout is available. And those are going to be some talking points that we're going to be sharing during this live event. But I want you to be able to see Brittany and I. We want to see you. So anyways, we're going to downsize that and just have it available for you guys to pull up afterwards and be able to have as well. So if you're on Facebook, we'll be posting the link there as well here in just a little bit. Okay, let's get started.
Okay, I went ahead and posted the link for the giveaway on Facebook. I'll go ahead and do it on, I just did it on Crowdcast too, so we're good to go. It's in both places. If you guys have any questions, just let us know though.
And it looks like, thank you, Brittany. And it looks like Emma says, hi, I'm post-op from a revision December of 2021 from VSG to Rouen. I'm on today because I also miss your lives, and you can never have too much info. Oh, with Bariatric Life. You know, there might be something that might, who knows, help you, even if you're post-op, I think. You never know. We are going to talk about resources, so maybe something with that'll help you. So thank you for
And
being.
we're always open to new topics and suggestions too. I don't know if we've mentioned that in a while. We have quite a bit of topics out there, but if there's something you need to more know about, just let us know.
And for those people who are post-op that are hanging out on this call, like Emma, you guys, you are part of this group. You're these are to be meant to be, the information is meant to be shared amongst this whole community. So if there's something you can add while we're talking, please feel free to chime in. There might be something that will be able to help somebody else too as well.
Yeah, you're a great resource for these people on the call that are pre-op.
So yeah. Okay. So I'm going to say the very first thing when you're deciding on a surgery or revisional surgery is, resonating with the program that you're going to. That means with the staff, the nurses, the doctors, having a good relationship. And you can tell that like it's a heart feeling. Like you just know that it's the right program for you, because that is important, because these people are going to be helping you through one of the most transformative times. And to get to know them a little bit, there's nothing wrong with that. There's so many most areas, where people live, most of the time there's many different avenues to be able to serve you, like locally, like in your areas. I'm sure most of you probably will have more than one choice. Some of you may not, like some of you may have, it may be further. Another thing too, it kind of is interesting, is your insurance may dictate part of that. And we're going to talk about the insurance part, because where you decide to have surgery, your insurance may be impacting.
Yeah, they might kind of dictate that a little bit.
Yeah. We're also going to talk about, when you're talking to a program, it never hurts to have done a little research. Probably, I think that this group, out of many that are out there, research things to the nine. It's like always checking things out before actually going. Maybe you may have in your mind what procedure you may be interested in, but then after you talk to the surgeon may help you further clarify that decision. Qualifications is a big thing, so we're going to be talking about that. And then your insurance benefits. I think one of the very first things whenever you're checking to see if you have benefits for bariatric surgery or revisional surgery is to call your insurance company. And we're going to be giving you on this guide that I've made. I actually made it very similar to the part of it is very similar to the little guide I used to use as a coordinator when calling insurance programs and talking to them, because I feel like it's helpful to have something written down to be able to go over with the insurance company. So we're going to be talking about that so that you have something to guide your conversation. Now, a lot of these bariatric surgery programs are very experienced with making these calls. So even if you call and you don't get the answers you want, you can always talk to the program you're interested in, have them call as well. I would strongly recommend that, because they can also kind of dive into the pieces that they know are typically required, and you can make sure you get all the answers you need. So once you've kind of gotten into a program, and that means, talking to a bariatric program, maybe scheduling a seminar. Many programs offer bariatric seminars, kind of talking about their program and the surgeries they offer. Has anybody ever out there went to a bariatric seminar, either online, virtually, or at their program? Like if you're preparing for surgery, let us know if that's something that's helped you. I think that that's one of the biggest things that can help patients. A lot of times the surgeons or the nurse practitioners for the program, the people that are licensed in the program, typically will be the ones with helping put that on, whether virtually or on site. I know we used to require patients for a while to have to do that. It looks like there is a comment. Brittany, did you want to, on Facebook?
Dr. Pernia has someone in his office that helped me with the program. Yes, and Jackie said yes, so she must have had that as well.
Yeah, I think having people kind of help you navigate the system. So once you've talked to the bariatric surgery program, once they've kind of checked your insurance, and again, we're going to talk about insurance in a little bit, Then the big thing is moving towards the required appointments, and we'll talk about what those look like. You're going to schedule all the necessary appointments. I'm making sure I have that in my notes further on down the line. Yep, I do. Okay, so you're also going to work really closely with your primary care doctor. There's two scenarios. Either you've been seeing a primary care doctor and that doctor has worked closely with your medical issues in the background. Maybe you've had high blood pressure, diabetes, sleep apnea, back problems. There's such a myriad of things. A lot of times people who are preparing for surgery are managing. Yeah. That doctor, the primary care doctor, yes, is going to be the one that's going to help manage all your medical problems. Your surgeon is going to help manage your surgery. So there's a very large difference. It will be very necessary for you to have a primary care doctor, even if you've never had a close relationship with one before. You're going to want to get in touch with one and maybe see about scheduling a initial appointment. Some programs actually require you to have so many appointments with that primary care beforehand in order to do like a supervised diet. And we'll talk about that more here in a little bit as well. But nevertheless, in order to have weight loss surgery, it will be required if you're having insurance, if your insurance is dictating, and probably even most programs would require without, just because it's something that just shows that you're safe for surgery. Most programs want you to have at least minimum of a primary care doctor see you and say you're medically stable for surgery. Mm-hmm. I'm taking a pause there, see if there's anything, Brittany, you wanted to add.
No, I'm just kind of checking the comments and the questions. It looks like we did have a question carry over from Facebook, and we're probably going to go over that in the call sometime. It says, what do you do if your insurance doesn't cover weight loss surgery?
Yes. So we will definitely be talking about that. 100%.
I didn't mean to jump ahead. I just wanted to make sure you saw it.
Yeah, and you know what? Actually, too, alongside that, if anybody who's on our Crowdcast platform have questions, please post them in that questions and answers box, because we can timestamp that on our video. And then if you can't stay for the whole call, we'll make sure we'll timestamp it so you can go directly to that answer. You don't have to listen to the whole call if not everything interests you. So just to kind of say, if you are on Crowdcast. Okay, so the very next thing is if you have, like, let's say you're going into bariatric surgery and you have medical issues kind of in the background. We kind of talked about some of those. Maybe you've had reflux, maybe you've had lung condition before, some kind of lung problem like COPD. Maybe you've had blood clots in the past. Maybe you've had thyroid problems. Maybe you've had sleep apnea. Some of those things may need additional testing before surgery to make sure you're safe. So some of those additional tests may include things like an EGD or a pulmonary function test or chest x-ray or blood studies, venous Doppler studies, to check the blood flow of your veins or your arteries, and sleep studies. Now, I wouldn't just dive in and have your primary care doctor order a bunch of stuff, unless, of course, they're requiring you to do that themselves because they feel it's needed. They feel like it's what's helping them make the decision for you to have weight loss surgery. But your bariatric surgeon will also play a part in helping to decide what testing needs to be done before surgery. So there's no need, unless your primary care doctor orders something that's required. So I would suggest, though, if you have a history of pulmonary problems, cardiac problems, or anything else that you feel may warrant additional clearances, to go ahead and talk to those physicians and see if they're willing to give you clearance. It may require additional testing for them to be able to do that, but it helps the game get a little quicker, whether you're having, again, primary surgery or revisional surgery, because what happens is sometimes those clearances can take 3 months, 6 months, depending on all the testing that's required, and maybe it's medication trials. Let's say your blood pressure's way high and the medical doctor wants to make sure it gets stabilized, or let's say you have atrial fibrillation and the doctor wants to make sure you're in a stable rhythm, or let's say you have a Doppler study, you've had blood clots in the past, and maybe they need to put in, they call it a Greenfeld greenfield filter in order to reduce your risk of blood clots during surgery. So not to get too deep into the rabbit's hole, I'm just saying if there are medical considerations, there may be additional things that they can do to prevent complications during your surgery, and they're going to want to make sure that you're maximized on that and safe beforehand. Make sense so far?
Yep.
Okay.
We don't have any questions.
So, in addition, I mentioned earlier, some insurance companies and some bariatric surgery programs may require some kind of medically supervised diet prior to surgery. And what that typically looks like is you seeing either a primary care doctor, a nutritionist, or both, and getting documentation that you're seeing them on an ongoing basis. Typically, it's month to month for a specific period of time. Some insurances require 3 months, some require 6 months, some require a full year. I know the veterans is pretty much a stickler. They have their own medically supervised program, which actually is a full year. A lot of insurances, though, are 3 or 6 months. The other huge thing is stopping smoking. And every bariatric surgeon probably differs a little bit in how strong their opinion is on this topic. Some surgeons won't do surgery if they know that you're smoking. Some will be a little bit more lenient. Just know that it would be strongly advised that you do. And the reason why, especially with certain surgeries, like, for example, like the duodenal switch or the bypass, they call them anastomoses, which are where part of the gut is actually connected to, the stomach. And those little areas can develop, they're more at risk for developing ulcers. An ulcer basically is just like an irritated area of the stomach lining. And basically what it does is there's different levels of ulceration, kind of like if you scratch your skin versus a deep cut. There's different levels of ulcers, kind of like just if you're thinking about your skin being kind of like your stomach, different levels. The deeper the ulceration, the more riskier, the more problemsome it can be. And so smoking actually increases your risk quite a bit of having ulceration. Some other big risk factors are steroid use or NSAIDs, non-steroidal anti-inflammatory. So the doctor would have to kind of caution or talk to you if those are things that are really strongly in your background. So can I keep going? So let's talk about insurance here. Okay. We're gonna say it looks like we do have a couple things on.
Yeah, I was just gonna say. Do you want to? You can go ahead and read it.
Okay, it looks like Bernadine says, I had acid reflux really bad, and they said that I would never have a heartburn after the surgery, but now my heartburn is coming back. What can I do about that? So, first of all, I want to ask what type of surgery you had, because that's a big consideration on knowing what your next steps are with that.
Yeah, I agree.
A gastric bypass or a sleeve gastrectomy or duodenal switch. And then Jackie says, I had hiatal hernia and reflux, and what helped me is watching what you drink and eating or drinking at night. So those can be helpful things as far as lifestyle.
And so she had, I think she told us, she had gastric bypass in 2019, Brenda.
So typically the gastric bypass is like the most probably recommended, I would say. I'm not a surgeon, but I'm just repeating what I've heard a million times. That is one of the most recommended surgeries for somebody that's had reflux, because like the sleeve gastrectomy, a lot of times it can actually worsen it because of the pressures inside the stomach area. But I'd say if you've had that, the other considerations, maybe just talking to your surgeon and seeing, there are medications that can be prescribed, like Prilosec or Protonix, they call them PPIs, proton pump inhibitors, that can greatly reduce the amount of acid production in the stomach. Sometimes it's helpful because they can do like an anatomical check, like meaning they can go down into do an EGD, like a scope down your esophagus. They give you medicine to help put you to sleep. They go down and they look at the anatomy of the stomach and they see if there's anything like anatomically wrong, maybe that needs to be corrected. So that would be another thing. Maybe if you did not have hiatal hernia repair, maybe you've developed a hiatal hernia, or maybe there's something else that could be alongside that.
And I just want to say that to add on to what Brenda said, that there's a reason why you're recommended to space out your fluids and food intake too, and you're not supposed to do it at the same time. And I know that she's pre-op 2019, so it's been a few years. Well, December 2019, so it's been 2 years. But even just 2 years, you still should really try your best to split it up, because that can sometimes cause, irritation, and I've heard of it causing heartburn for other patients too. So just make sure that you're doing your best to, wait 30 minutes after you eat before taking a drink of anything.
Yeah. So there's lifestyle things that have been mentioned, like Brittany just said. Those things are super helpful, like your eating and drinking, the positioning of your body after eating, making sure you're more upright rather than laying down. That can help with the food migration.
She said I did have a hernia surgery, hiatal hernia surgery. So
and it looks like she's agreeing with you too, Brittany, about always drinking first makes a difference, like what you put in your stomach. So that is a big thing. But, if there's medications can help, the lifestyle stuff, how you eating and drinking, maybe kind of keeping a journal and seeing what makes a difference. And then, if that doesn't help, maybe talking to the surgeon. One other big thing that I want to say is the kinds of foods that you're eating can make a difference. If you're eating not only the kinds of foods, but the way that you're eating too fast, eating too much, not chewing your food good, eating highly fatty foods, eating
or
a lot
acidic foods. Like I said, I have not had the surgery, and I usually don't have heartburn problems, but as I'm getting older, I've noticed that there are some things that my body just does not like. Sometimes even just tomatoes or red sauce, or those are really big triggers of heartburn for me. So maybe finding a food that's triggering it for you, food journaling, and narrowing it down and seeing what it is that might be irritating it. Red sauce is the worst. That's what Byron said. Yes, it is. Even just sometimes tomatoes do it for me, not even necessarily the sauce, which sucks because I love tomatoes.
So true. And Byron says, so you're saying if you drink, don't eat until 30 minutes after. So that is the recommendation is to wait 30 minutes between eating and drinking. Whether you drink first and wait 30 minutes to eat, or you eat and then wait 30 minutes to drink. And part of that is for a couple reasons. Number one is that if you fill your belly up with liquid before you're eating, you're not going to be able to eat as much. And as being a bariatric surgery patient, it's important that you still get nutrients in. Secondarily, it can actually act as kind of, if you think of your stomach as a funnel, and then you put food in there, which is more dense, and then you put liquid in, which is a lot lighter and kind of mixes it up. Things go through your stomach much quicker and much faster.
The nutrients don't absorb,
and making you more hungry more faster, more quickly as well. Things go through there very quickly.
Yeah.
Okay, I'm going to jump back in talking about a little bit about insurance. Now, guys, I actually have this piece, which I am going to pull up just so that you guys can kind of see the talking points here real quickly as I'm kind of going over this, because I think it might be helpful to share this just on this part. And I'm just going to kind of, can you see this? Insurance coverage. So like, let's say you're getting ready to have weight loss surgery at the first time or revisional surgery. This little handout may be very helpful for you to have in front of you when calling your insurance company. So there's a customer service number on the back of your insurance card to see if you have bariatric surgery benefits. And these are the questions. You're going to make sure you get a hold of a representative that can help you. Now, I'm trying to say this. I'm trying to figure out how to say this in the most nicest way. And when you call, there's chances that you may get somebody who's very experienced or somebody who doesn't have much experience. So if you get somebody that doesn't have much experience and you're not getting your questions answered, simply ask to speak to somebody who maybe is more highly qualified, manager or whatever, or you can hang up and just say, you know what, just try back whenever you're able to try back again and see, because their representative, it's kind of like everybody's level of expertise is a little different. Bariatric surgery, I'm going to tell you, is one of those niches that is probably not something they come across every day. So every representative may not have the same level of expertise. Also, make sure that they're pulling up your policy, your policy. So we're going to kind of start up here at the very beginning. So asking them what procedures are covered. Down here at the bottom, if it helps, you can give them the diagnosis code for morbid obesity, telling them you're checking on bariatric surgery policies. We have some of the codes down there at the bottom, kind of bringing it up a little bit because my sheet kind of small. Diagnosis code, sleeve, bypass, lap band, duodenal switch. If you're having a revision, you may have to get that code from your bariatric surgery program, depending on what you would be having done. Also, what the BMI requirements are, it's going to be very different depending if you're new to bariatric surgery or whether you've had bariatric surgery. And I'm not sure if this is down here at the bottom, but you also want to see if there's like, if you've had bariatric surgery, if there's any kind of stipulations on your policy that say you can only have one procedure a lifetime. Sometimes that will be the case, sometimes it won't. I don't know that I have that on here. Which services are covered inpatient and outpatient. So a sleeve gastrectomy, even though a lot of times you'll spend the night, is still usually classified as outpatient. Depending on the hospital that you're going to, you probably would just want to check with them and see how they do it. Inpatient, many times like the bypass and duodenal switch will be covered as inpatient. Again, it doesn't mean, even if it's outpatient, it still doesn't mean that you wouldn't necessarily be spending the night, but it might be something to check on. Revisional surgeries, I would say more than likely, those would be considered inpatient. If your insurance requires you to go to a specific facility. So here, this kind of outlines, these next questions are really helpful to ask. Maybe if they require an accredited center, which means maybe like they require an ASMBS, COE, or Center of Excellence. American Society for Metabolic and Bariatric Surgery, Center of Excellence. That's a qualification that your hospital would need to have if they require that. Maybe a Blue Distinction Center, maybe an Optum Blue BRS Center. Those are all different facilities that may be required. So you may have, the insurance company may be able to tell you which hospitals are close to you that offer those services. If not, you could call around in your area. What your deductible is and what your out-of-pocket requirements are can really, really, really help you know what your out-of-pocket expenses are going to be, because that's really important when you're kind of preparing for this. What networks are in network and which facilities that are out of network. And if your facility is out of network, what your out-of-network coverage is. You may actually have some coverage, but you may not have as much as you had with in-network. And then a huge one is policy requirements for pre-op, like pre-op diet, 3 or 6 months, BMI specifications, and surgeries covered under the policy. Those are all huge, 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 because every insurance can differ. I would say this is double-starred here, get a copy of your policy. I cannot recommend that highly enough, even if you don't know how to read your policy very well under the bariatric surgery section. You can actually have one of the people at your hospital kind of go over it with you.
Mm-hmm.
It's going to be helpful for them to have a copy. So be sure and check back, and also be sure and check back periodically to make sure that nothing has changed on your policy. I'm going to kind of stop sharing for a second and talk about that, because let's say you call in January and you have coverage and your policy says it covers a sleeve gastrectomy and you're not required to do a diet. And then 3 months later, you're preparing for surgery and all at once you find out you're required to have 3 months, you know, pre-op diet. Things like that can change. So you might want to ask your insurance company how often they change their policies, if they predict any kind of policy changes when you should be checking back on that. Because for some people, weight loss surgery is a fairly quick process. Some people can, go in and have surgery within a couple months. For some people, it can be a year or longer process depending on what all is going on. So
Our Canadian friends take longer sometimes.
Comedian?
So I said our friends in Canada take longer sometimes. They actually are not doing surgeries at all right now with COVID.
Oh. Is there any other areas out there, you guys, that are not doing surgeries right now that any of your programs you're waiting because of stuff going on and you're not doing these? Oregon?
Letitia said Oregon.
So they put a halt right now to surgeries?
I think that they're just like Canada, I know some of our friends don't even have a date because they're just not sure. I don't know if maybe in the United States they're just pushing everybody back like, a couple months but then there's some programs that have not shut down at all. Or if they did, it was in the very beginning and things are kind of back to normal for them.
Okay.
I wonder, this is a quick question I just thought of actually. I wonder if, like with COVID going on, if it's almost harder for you to go through the insurance channels to get surgery.
Wow, 6 to 12 month wait after consults is what she's saying, Letitia. So every program's a little different, every area is a little different depending on what's going on, because they consider bariatric surgery a what is the word for it? It's not emergency surgery, basically.
Yeah, non-emergency. Yeah.
Okay, well, I'm going to keep going, Brittany. I also want to talk about private pay. So this is part of the checklist. If you guys are on there, I'm not going to bring it up because I don't want to bore you guys, but I just want to say, if you're looking for options outside of insurance, or maybe your insurance covers, I've known some policies that'll just cover maybe part of bariatric surgery, like half or something like that, and then patients have to finance a large part of it. Some things that you can consider is like care credit. Some hospitals offer care credit. Some hospitals, they allow financing through their own accounting department, so you could check on that. A secured medical loan, but interest rates, you always want to check about the interest rates. You want to make sure that you're getting an interest rate that's okay with you. Personal credit cards, now those I would just be a little cautious because interest rates can be very high with those. You could always refinance, I guess, if you did it on a personal credit card and then refinanced some other way, but you could talk to your bank and just see if your bank is willing to help you with that. Hospital payment plans, and what I mean from that is varies from facility to facility if offered. So that's kind of what I was talking about, like the accounting department at the hospital. I know the hospital we worked for, they originally would offer payment plans, but they kind of had a problem with people paying them back, so we stopped offering them. But there may be hospitals out there that finance through their own.
You never know, yeah.
Using tax refunds. So it is becoming that time of the year where people are getting refunds. So something to save back for. Save back cash. Virus says cosmetic. So that's another thing too. Like if you're doing cosmetic surgeries, a lot of these cosmetic surgeries aren't maybe 100% covered by insurance. So that's something to consider too for that if you decide to go back, the private pay piece on how to find the money for it. But people are good about saving back money. If you save back so much every week until you get a really good down payment, I don't know as far as how much they require because it's going to be very individualized by each program, like hospitals, and that type of thing. But you'd want to know kind of what your cash pay price would be, and how much you would want to finance if you did save back some cash, or if you save back the full amount, how much you'd be working towards. Getting an additional, one thing I want to mention is you may even want to consider getting additional insurance policy on bariatric surgery, primary or secondary to what you currently have. Because there are costs out there.
I just wanted to say hi to Laura. She's our friend from the WLSFA, Laura Van Tool. Hi. She actually just did a live with us, guys. If you want to learn more about the WLSFA, check it out.
This is great timing, too, because we're talking about financing, and if you don't have the money, WLSFA offers grants, you guys.
They do.
There is a process. Check out their website. Jump on there. They are having a conference coming up, which I'm really excited about. We're going to be a part of. It's very soon. It's coming up within the next month. And check that out. But check out their grant process, too. There are grants out there. There's not very many of them. Laura, thank you for what you do, because
she's literally saving lives, guys.
Yes.
Like, that's what they're doing. So, very special organization. And she put the link on our Facebook, and WLSFA.org.
And are you doing it on ours? I tried to type it in, but
that's okay.
People probably know. Also, you guys, other things. Talk to if your insurance is not covering. Talk to your HR department, human resources, your employer. See if they could add this on as a rider to your current insurance policy. You can also use funds through a health savings account, HSA. So those are all things to help with funding of that. So I'm going to kind of move on, because we're kind of actually got a couple more things to kind of talk about before we kind of end. I want to say consults and clearances. The normal schedule of appointments kind of goes. Usually your surgeon's going to want you to see them, this bariatric surgeon. A lot of times you'll be required to have psychology evaluation and clearance. You'll be required to have a nutritional assessment by a nutritionist, usually the dietitian that's on staff, or the nursing staff, and then pre-op education. So those are 4 huge things: bariatric surgeon, psychology, nutritional assessment, and your pre-op education. So those things, every program's a little unique in how they offer those. A lot of times they have a lot of written materials that they give you as well. And then additional appointments. Did you have something, Brittany?
Hold on. This is actually really cool in our comments. So Jackie, that's been commenting, she was a grant recipient from the WLSFA. She said, I got a grant from the WLSFA, which funded my surgery. Truly blessed and saved my life. Jackie, oh my gosh, that's so cool. Yeah, Laura says Jackie is a grant recipient. Awesome. That's great. See, it just shows you that these people are actually out there making a difference. So cool. Sorry, go on.
The likelihood of Jackie and Laura both being on the call together. That's amazing. That's wonderful.
Small world.
That could help somebody else too out there. You never know.
Yeah.
So we were talking about additional appointments. It's hard to get back on that topic after that segue. Additional appointments. So we talked about, all of those appointments to your program, also your primary care, any specialists that we mentioned earlier that you may be required to kind of get in touch with, your pre-op appointments for supervised diet, and then all those testing required by your surgeon, your primary care, or your insurance. Sometimes insurances will require some things. And I'm just going to kind of segue into some lifestyle changes real quickly, Brittany. I'm going to just talk briefly on those, and then 1 to 4 weeks before surgery, because we're getting close on time.
Okay.
So lifestyle changes. What I want to say is some big things that may be helpful in kind of considering before kind of investing in surgery, or if you're a revisional surgery, maybe kind of checking out and seeing if there's anything you can maximize in your lifestyle, would be the smoking issue. Not smoking, of course, we talked about that. Sometimes nicotine screening may be required before surgery, so you're going to want to know when that would be required. Typically, it's right before surgery, so you probably need to be nicotine free for, I'd say, at least probably close to a month prior to surgery. Exercise, physical activity, starting to do something. That level of physical activity is different for every person.
Mm-hmm.
Eating habits, portion size, slowing down, chewing your food good, focusing on getting enough fluids, getting enough protein, drinking your water, and support groups like this, coming in and being around like-minded people that can help answer questions that you might have that may be keeping you or holding you back, because that's a big thing. People get held back because of that. Now, there's a lot of things that I have listed on this 1 to 4 weeks before surgery. Now, I'm going to kind of be brief, but guys, this handout's available and you guys can come back and look at it because there's so much information. I'm going to say some of the big things. I'm going to point out some of the big things. Know when your pre-op diet is, when to start that, what that looks like. Finding protein supplements that you like. I want to mention Procare Health, since they're our sponsor. We did actually just get in protein, so we have some protein available. 26 grams of protein, wonderful flavor, chocolate and vanilla flavors, hot off the presses this last week. Hopefully we'll be able to offer samples of those real soon. Right now we just have that online right now. Just kind of.
Mm-hmm.
The other thing is talking to your surgeon about medications. So certain medicines may need to be avoided, but right before surgery, NSAIDs, Plavix, Coumadin, Pradaxa. So if you're on those medicines, finding something to bridge you over until you have your surgery that's still safe and reduces your risk of blood clots. Now there are herbal medicines out there that maybe cause you to be a little bit more at risk, like vitamin E or fish oil, ginkgo biloba, garlic. Some of those have blood thinning properties. If you're on medicines like Syndramine, you may have to stop that a certain period of time before surgery because that can alter the effects of your anesthesia. Other things like Adipex or Contrave, all of those things would probably need to be stopped at least a week before surgery. Steroid use, if you're on steroids for joint problems, or maybe you have some kind of medical condition that requires you to have those, like you've had a transplant, or you have some kind of immune suppression, some kind of immune disease that requires you to take those, that might be really important for you to know ahead of time when that would have to be stopped. Bariatric vitamins, finding the bariatric vitamin that you truly like and that fits you, super helpful.
Mm-hmm.
Planning to bring your CPAP or BiPAP to the hospital. If you've had a sleep apnea test in the past and you have a diagnosis of sleep apnea, that will be so important to have that BiPAP, CPAP right after surgery because of the effects of anesthesia. Also, if you develop any sickness while you're preparing for surgery, there's a lot of things going around right now. If you do get sick, you want to make sure that you stay safe, and may require making sure that your provider's aware of that.
Mm-hmm.
And then just briefly, some other things would be things like your pill size. Like if you're on metformin or some other pill that's really large in size, you're going to want to talk to your doctor about seeing what you need to do as far as changing that up. If you're on any kind of sustained release or extended release medications, sometimes those need to be changed or altered, especially with a gastric bypass, which is the way your body absorbs medications. And if you are going to a pain specialist doctor, make sure and talk to them, because very likely that the surgeon's going to want to give you pain medication after surgery, and you don't want to break your pain contract and not be able to get your subscribed pain medication. So big thing. Somebody asked about chewable vitamins, and some surgeons they want you to take chewable vitamins right after surgery for a period of time. Some it makes no difference to, so it depends. You want to show, Brittany, what we offer as far as for Procare, our sponsor?
Yeah, I was just going to show you guys real quick, and then at the end when Brenda is done, make sure you stay on the call just a little longer, because I am going to show you guys our website and how you can get free samples from Procare Health, especially for you guys that are pre-op. It's kind of important to find a vitamin that you are comfortable taking. They don't make you nauseous, so why not try some free samples to figure it out.
Brittany, why don't we go ahead and segue into that? Because
Do you want me to? Okay.
everything I've pretty much had on our little handout, you guys, it's available for you guys. You can read it after. I think I've went over most everything, and I'm going to let her share some things with you regarding our sponsor for you.
So, can you see that?
Yes.
Close to hide the message. Okay, perfect. So, really quickly, for those patients that are pre-op that might be getting the DS or SATI surgery, we have a specific formula for you guys because you do need, you do have separate needs because your surgery is so different and your absorption is, you just need more. So we went ahead and created a formula for those patients, and it is the same price as our regular vitamin, or I shouldn't say regular, our original vitamin that we first created, and I'm going to show you guys that now. So you'll go to procarenow.com. For those of you that want to try a free sample, as Brenda said earlier, we have all of these like captions up here. You'll just click the free sample. I'll go ahead and copy that and put that in the chat real quick too. And yes, so you can just fill out all the information here, your first and last name, and then down here, if you have a specific flavor or something that you are wanting to try, like maybe you are getting the DS procedure and you would like that instead of the original, you just want to put that here in the message box and click send, and then we fulfill the sample order for you. And it is completely free. You don't pay for shipping. It's none of that. You pay $5, get $5 towards your next order. It's really actually free, which is nice. Because a lot of other companies, they don't do that. You have to pay, I think it's like $5 or $10, and then that $5 or $10 goes towards your next purchase with them. So our original formula that I was talking about here, we have a capsule and a chewable. Most programs that I'm aware of prefer patients to take a chewable within the first 3 to 6 months after surgery, just because they want your stomach to be nice and healed before you switch over to a capsule. Now, me personally, when it comes to my vitamins, I'm more of a capsule person. Brenda, do you prefer chewable or capsule?
I went through different periods. Right now, capsule, but I mean, I've been. It's funny how you change over time.
Yeah, and like before I did like the chewable, now I just kind of like the capsule. But yeah, ask your program what they're going to want you to take after surgery. Some are okay with you taking a capsule. You got to ask, and of course it depends on what surgery you have too. Everybody's different. So, and then, and then here we have our capsule formula. Both our capsule and chewable formula come in 3 different levels of iron. If you're someone, that doesn't need as much iron, we can definitely get you a lower dose. The only thing I will say is in our chewable, we have 2 flavors. We have citrus and fruit punch, and our citrus flavor only comes in 45 milligrams. But other than that, all of the other ones, you have the flexibility of choosing your own iron level. And lastly, I did want to go over some calcium supplements with you guys because that's important too. So we have our original calcium soft chews here. Each chew has 500 milligrams of calcium and 500 IUs of vitamin D. We recommend, I'd say 2 to 3, depending on the surgery that you have. And we also have our calcium dark chocolate bars. These are seasonal, guys. They're going to be taken off the website in the next coming months, so make sure you stock up on those if that's something that you can't live without, because in the warmer months we don't ship because it just melts. So, all right, I'll stop sharing my screen. If anyone has any questions about anything. And as I said, so you should get in the sample pack, you should get a capsule. You should get a capsule, and you should get a chewable, so you can figure out which one is better for you. Like I said, some people have a preference, so it's really nice. And then you also should get some kind of calcium supplement, whether it be a calcium chew or some UpCal. So yeah, just make sure that you guys, can you get more than one sample? I received a set of samples before. Byra, you should be able to still, it depends on how long ago it was, but yes, I would think so. If you have any problems, you can always email me too, and I can make sure that I get you guys some samples. Just placed an order 2 days ago, but I can still sign up for the freebies. I didn't know about that. Yes, Stephanie, yeah, go ahead and request your free sample pack, because who knows, there might be something in there that you didn't order, you know, and try something different.
Or if you see something on the website, like Brittany mentioned, you're welcome. There's a little free text box. You guys feel free to use that.
The only thing I will say that we are absolutely not sampling right now at this moment is our protein, as Brenda said, just because the individual packets are not in yet. And this is it's a 2-pound bag. So we can't, you know, sample that just yet. But it is coming, guys, and I'll let you know.
So I think we, Emma says, I take Procare food chewables, taste much better than others I have tried.
And we're very affordable. I don't think I even said that, but and if you saw on the website, but 30 chewables is only $11.99 a month. So it's extremely, extremely affordable. We were actually originally created to compete against Flintstones. So we're still very affordable, but we meet all of the guidelines that ASMBS has set out before us. So
Laura says caramel cheeses are amazing. She likes the caramel.
Oh, is that on our Facebook? Oh, yeah, it is.
Laura. She likes these. You know what, Laura? I'm with you. I have to say these are my favorite.
No, the cinnamon roll's my favorite.
My mom likes the garment, I have to say. But anyway, not to get off track. But I think we're winding down. Barbara says, I've been doing my comparisons, and yes, very affordable. Yeah, on our website, there's actually, I'm going to really quick screen share, Brittany. I hope I don't freeze.
No, you're good.
I'm going to show you real quick where that's at. Like, if you guys go to the website, at the very top where these little things are, there is About Us, and down here where it says Comparison, comparing bariatric vitamins, there is like a whole comparison against other major vitamins out there and the prices and what each of those require. So, Bariatric Advantage, Fusion, Optisource, Celebrate, Flintstones, and Centrum Complete. So if you're wondering how we compare, that's one way to do that. That was at the top, About Us, and then Comparison.
And it's really nice because not only does it compare in price, but it compares in the the daily recommended value that's in there. It compares each and every vitamin and mineral, and it shows you how much is in our formula versus the other company's formulas. So I happen to think that that's really useful, because then it also shows you how many pills or vitamins you're taking a day too, because some of those aren't just one, some of those you're taking 2, 3, sometimes 4 vitamins a day. So that's another thing. It's easy, it's affordable, and it's one and done, and then you just have to worry about your calcium. So all right,
the name of the game. But that's all we have. That's all we have for today.
Oh, wait, Jackie. Sorry, we have a quick question. Jackie said, I have a question about the ingredients. I'm a diabetic. Do they have sucralose? Are you talking about the vitamin, or are you talking about the calcium or the protein? I just want to make sure that I answer it.
I know on our chews, those are the only all natural one out there, and they're actually made with tapioca syrup and raw cane sugar, palm oil, and they only have 3 grams carbohydrates. They're really easy on the stomach if you've had gastric bypass. So those, as far as our multivitamins, I don't think that we actually, we do have mannitol and sorbitol in those, in the chewables, but not in the capsule.
The capsule, I don't think does, though. Yeah.
The capsule formulation does not. Just in the chewable.
Just cellulose, which is that's what the vegetarian capsule is. itself. And for those of you wondering how big it is, because I know we're going to get a question next about that. So, I mean, I have pretty small hands, but, and you can also break this open and put it in food or something too, if that helps you. I know some people can't have trouble swallowing, so, but yeah.
There was one thing I wanted to go back and look at real quick. Somebody said they had I think it was Enid, said she had an idea about.
Yes, Jackie, you can't open the capsules. I know people that have put it in Greek yogurt and like cottage cheese and that kind of thing.
I'm going to go back and look at the comments. There was somebody who mentioned something about upcoming support groups and having an idea. And I'm going to go back and read these to see what that was. Let us know if you have other ideas for other topics and stuff. We hope you guys enjoyed today.
I think it was the do's and don'ts of eating after surgery.
And I'm going to post the link again one more time, how to get to the support group handout that we just pulled up for this, so that you guys have that. I'll put it on Facebook and on our Crowdcast so that you guys have that. This little guide that was developed to help you through this process. So that'll be on both of those. I'll paste it.
You're welcome, Jackie. She said thanks. So, thank you for everybody for coming. Byra said last question, so I think she has one more question she's probably about to ask.
Oh.
Thank you. Do you have an Instagram? Yeah, we do, actually. It is, I believe it's Procare now. It's the only one that's different.
Yeah.
So the name of our company is Procare Health, but our handle on Instagram is Procare Now, and it's just all one word. I think Brenda's posting the link on Facebook.
Yeah, and I can put that IG name.
And then if you guys are going to be at the WLSFA event, make sure you come say hi to Brenda. She's actually, aren't you a speaker?
Yeah. Laura, thank you for that opportunity. I'm going to be speaking on two different things. I'm going to be speaking on support groups, like if you're wanting to get your own support group started as a patient or as an advocate. And then I'm also going to be speaking on a surprise. I have a surprise. The other one. So those two things. And my daughter Madison, who also works for Procare, will be joining me as well. Byra asked, do you send today's participation to our doctor's office? On the weekly lives, I do not. But if you need for me to, I'm going to send you my email.
Yeah, just email Brenda.
It's my last name, Hain, and I'll put it on Facebook too. Hain B at I put email.com. It should be Procare. I can't type Brittany Procare now.
It's okay.
Golly.
That's so funny.
Okay. I put it on Facebook too in case anybody needs to email me. So I'd be happy to do that. But I do send the support group. I do send those to your programs. I do send the registration from those. So I think that's all we have for today. We just want to thank everybody for joining us. And Brittany, I'm going to give you a call after this.
Okay.
And talk. And to everybody else, hopefully we'll see you tomorrow night at our giveaway.
Yeah, we're trying to figure that out. I think that's what she's going to call me about. Okay. Bye, everybody. And Anid, Brenda is going to send you an email soon, too. Yes. We did not forget about you.
No, we didn't. Thank you.
Okay, bye, guys. We'll see you next week and hopefully tomorrow.
Yes. Bye-bye.
All right, bye.